This video assignment is a pre-assessment of a hemodialysis patient. The patient used here today is my husband Joshua. Do you give me consent to be in this video?
Yes.
Okay. Hi there, my name is Samantha and I'm going to be your nurse here for your dialysis treatment. Can I please confirm your first and last name?
My name is Joshua Smith.
And can I confirm your date of birth?
January 1st, 1980.
And how are you doing today?
I am very short of breath and my feet are swollen.
Can I have a look at your ankles? I'm just going to check to see if you have any swelling or edema. Let's check here and here. Okay, it looks like you have 3+ pitting edema in both of your ankles, and I can see that your face is a bit more swollen than usual. Have you had shortness of breath at rest?
Yes, I do have shortness of breath at rest. I also have noticed that my face is swollen more than usual today.
I'd like to listen to your lungs. Can you just lean forward and I'll have a quick listen? Just going to have a quick listen to your heart here. So I heard that there were some fine crackles in the lower lobes. Your heart sounds normal, which is good. So the crackles could be related to having extra fluid in your body. Have you had more fluids to drink over this past weekend?
Yes, actually I was at a birthday party this weekend and I had a few extra drinks.
Okay. Let me just take your blood pressure and all of your vital signs.
This one?
Yes.
Okay.
There we go. Then I'll take pulse. Okay, so your respiratory rate is 26. Your sitting blood pressure is 187/98. You don't have any orthostatic hypotension from what I can see. Your pulse is 105 and your temperature is 36.8. You aren't wearing a nitro patch and your blood pressure or heart rate, you can put your arm down, are more elevated than your usual range. This could be due to you having 4 kilograms over your estimated dry weight and all the extra fluid that you've had at the birthday party that you said. Have there been any instances where you've noted abnormal bleeding or bruising? It's important to know because your machine uses heparin in it.
No pain, no bruising.
Okay. So have you had any signs and symptoms of fevers or infections?
No.
And have you had any changes or abnormalities to your skin, feet, or any wounds that you've noticed?
I haven't experienced any changes, but I do visit a foot nurse because I am diabetic.
Okay, how often is that?
Once a week.
Okay, well that's really good. It's important to take care of your feet because you're at a higher risk of having injury to your feet. And because you are diabetic, it's also harder for your feet to heal once they've been injured. Have you had any medication changes recently?
I have had a medication change. My doctor decreased the amount of blood pressure medication that I take. However, I don't remember which one it is.
That's okay. Do you have an up-to-date list of your medications with you right now?
Yes, I do. I have it with me right here.
Okay, perfect. I'll just have a look at that. Okay, I'll definitely show this to the nephrologist. Have you had any changes to your appetite or bowel movements?
No, I haven't.
Okay. I'll just have a quick look at your fistula just to assess it before we start connecting you to the machine, okay?
Sure thing.
Let's have a look here. I'll just take a quick lesson of it as well. Okay, your fistula looks great. There's no signs of infections, there's no bruising. I can feel the thrill and I can hear the breathe, which is great. And it looks like they've been using the rope ladder technique, which is good for your fistula. So I was reading your Cardex and it says that 3 liters is the maximum amount of fluid that we can take off per treatment. So we'll aim for that today, but however you are 4 liters over your dry weight in terms of fluid weight. And if I include the priming and then these 2 glasses that you're going to be drinking in today, right here, that is 4.7 liters. So that's significantly more than what we're going to be aiming for today, so you'll probably still be over your dry weight. I'm just going to make sure that all the programming is correct in your machine before we start dialysis. So we have the right dialyzer, the right dialysis bath, the correct treatment time, our UF target, the temperature is right, and I've got your heparin all in here, your sodium, bicarbonate, and your blood pressure frequency. So that's all correct. It matches the Cardex. Would it be okay if I spoke to you a bit about your fluid intake and then ways to get closer to your dry weight?
I would love that, yes. If I could learn how to manage my fluid intake, that'd be great. Thank you.
That's great. So we usually suggest limiting your fluid intake to 1 liter per day. So I can see that you have these 2 large glasses of water here with you because you're always thirsty. So I might want to suggest that maybe instead of water, you try having like a glass of ice chips. That might help to make you feel less thirsty. And you can also try it with certain fruits as well. If you freeze them, that'll help you with your thirst. We also have an ice machine here in the dialysis unit, so I can get you a glass of ice if you want to try that instead of the water that you've brought with you. It's also important to be aware of how much sodium or salt you're taking in, because the more salt that you take in, the more thirsty you're going to feel. And then that's going to make you drink more water, and you won't be able to stay within the 1 liter per day that you're trying to stay. I'm also going to be contacting the nephrologist to see if there are any further changes that we can make to your prescription to help you get the most out of your dialysis treatments. Okay. So my suggestions for the nephrologist would be to have an extra day of UF only this week if we're unable to achieve his estimated dry weight today, and in the future to increase his dialysis treatment to 3.5 hours each time he comes in for the 3 times per week. That will help to increase his URR since it's below 65%. It'll also help us to increase the amount of fluid we're able to take off each treatment. I'd also like to review his past blood pressures, the updated medication list that he brought in today, and so that BPMH can be completed. So that would help us to understand why his blood pressure is elevated today and if it's been elevated for a long time. It can also help us to figure out which medications we need to change, which medication needs to be adjusted so that his blood pressure and his heart rate can be managed appropriately. I would also suggest increasing the temperature on his prescription so that way it can help to decrease his blood pressure while he's here for dialysis. I'd also talk to the nephrologist to do electrolytes today before his treatment starts so that we can see what his sodium level is, because if his sodium level doesn't match his prescription, it could also make him feel more thirsty when he's at home as well. Thank you for watching this video.